How AI is becoming your doctor. AI in healthcare.
The cold stethoscope. There is a moment we all fear. The moment you sit in a cold room, on a paper sheet, waiting for a doctor to walk in and give you news that will change your life. It is benign. Or it is cancer. For thousands of years, medicine has been a human art. It relied on a doctor's eyes, ears, and hands. But humans are flawed. Humans get tired. Humans forget things. And sometimes, humans miss the tiny shadow on an X-ray because they have been working for 24 hours straight. What if your doctor never slept? What if your doctor had read every medical textbook in every language, remembered every patient case in history, and had hands that never shook, not even by a millimeter? We are no longer just building machines that chat. We are building machines that heal. But this brings a terrifying question. When you are at your most vulnerable, do you want a human hand holding yours? Or the cold precision of a machine? Welcome to this episode about the doctor that survives you. Diagnosis. The second pair of eyes. To understand this revolution, we must begin with the simplest part of medicine: seeing. Radiologists are the people who study CT scans and MRI images, looking for early signs of disease. But the workload today is enormous. By 4 o'clock in the afternoon, their eyes are tired. Their brains are exhausted. This is when mistakes happen. And now, enter AI. In hospitals, from London to New York, AI systems are becoming a second pair of eyes. It works like this. The human doctor looks at the scan and says, "It looks clear." But the AI, trained on tens of millions of medical images, suddenly highlights a tiny gray shadow in the corner of the screen. It says, "Please look again. I have seen this pattern before." In most similar cases, this was the early stage of a tumor. The doctor looks again. And this time, they see it. The AI does not replace the doctor. It makes the doctor sharper, more careful, more precise. It helps catch disease while it is still treatable. Robotic surgery. The steady hand. But seeing the disease is only the first step. Sometimes, you have to cut it out. Here, the human body becomes the limiting factor. Even the best surgeon in the world has a natural hand tremor. It is tiny, almost invisible. But when you are operating on a brain or on a fragile blood vessel, that microscopic shake can be deadly. This is why surgery itself is changing. Doctors now operate through robotic systems. They do not stand over the patient. They sit at a console, a few meters away. When the doctor moves their hand 5 centimeters, the robotic instrument moves only 1 millimeter. The system filters out every tremor. It turns the human hand into something impossibly steady. The doctor still makes the decisions, but the machine performs the movement. It is not a replacement. It is a partnership. Remote surgery and space medicine. The doctor has no borders. But if the doctor is sitting at a console, does the doctor need to be in the same room? Does the doctor even need to be in the same country? This is the beginning of telesurgery. With ultra-fast networks and predictive AI systems, a specialist in London can assist a patient thousands of kilometers away. The AI plays a critical role. If the internet connection slows down for a fraction of a second, the AI predicts the doctor's motion in advance. So the robotic arm does not hesitate and does not jerk. It smooths out the distance. And then comes the extreme case: space. If an astronaut suffers a medical emergency on the way to Mars, Earth is not an option. A radio signal can take 20 minutes to arrive. By the time help responds, it is already too late. This is why fully autonomous medical systems are being developed. They can scan the body, analyze injuries, make decisions, and control robotic instruments without any human command from Earth. The hospital travels with the patient. Designing cures, the impossible puzzle. But detecting disease and removing it is still maintenance. What if we could design cures instead? Your body is built from tiny biological machines called proteins. Their shape determines how your body works. For decades, scientists tried to understand those shapes. Solving the structure of one protein could take years. Then an AI system solved the problem. Not one protein, not thousands, but hundreds of millions of known protein structures. In weeks. This suddenly changed drug design. Scientists no longer guess blindly. They design medicine the way engineers design machines. Care and aging. The Japan model. But medicine is not only technology, it is also care. And this is where one of the world's deepest crises appears. People are living longer, but there are fewer caregivers. In Japan, this problem is already severe. So robots are entering nursing homes. Some look like gentle companion animals. They respond to touch. They react to voice. They notice stress. For patients with dementia, these systems reduce anxiety. They create calm. They create routine. At the same time, human caregivers wear powered exoskeletons, robotic support systems that help lift patients safely and protect their own bodies from injury. The machine supports the nurse. The robot comforts the patient. The dark side: dual use and privacy. But every medical breakthrough carries a shadow. The same AI that can design a protein to cure a disease can also design a protein to create one. This is called the dual-use problem. A system that understands biology better than any human can become a powerful medical tool or a powerful weapon. And then there is privacy. If AI analyzes your scans, your blood, your genome, it knows your future risks. Imagine being rejected for a job. Not because you are sick, but because an algorithm predicts you will become sick. Your future becomes a data point. The empathy trap. The robot that feels right. We once believed one thing was safe: empathy. We said machines can calculate, humans feel. But care robots are now designed to simulate emotional awareness. They adjust tone. They soften their voice. They respond to facial expressions. They ask gentle questions. And here is the uncomfortable truth. Many patients respond better to robots. Not because robots truly care, but because robots never lose patience. They never become frustrated. They never judge. They provide emotional attention, on demand, forever. It feels safe. It feels warm. And that is exactly why it is dangerous. The human question: where does this leave us? If a machine is better at diagnosis, steadier than a surgeon, and more emotionally consistent than a nurse, What is left for the human role? If we are not careful, human care may become a luxury. Real human presence, reserved only for those who can afford it. We may cure bodies, while slowly replacing human connection with perfect simulation. Conclusion. The doctor of the future will include machines. That part is unavoidable. The real question is different. Will we design these systems to protect human judgment, human responsibility, and human presence? Or will we slowly allow convenience, efficiency, and automation to redefine what care even means? In the next episode, we explore the most dangerous relationship of all: the companion, the friend that is not real.